So really, paroxetine or Paxil is the worst antidepressant ever? Well, in this video, we're going to discuss what paroxetine is and let you decide for yourself if you think it is the worst antidepressant. So let's get into it. So what is paroxetine or Paxil? It's an antidepressant that is classified as an SSRI, or selective serotonin reuptake inhibitor, and it actually increases serotonin in the neuronal synapses by blocking serotonin reuptake, and also by desensitizing the serotonin 1A autoreceptors. These autoreceptors actually inhibit serotonin in the brain, and so when you desensitize them, it actually helps to increase the serotonin that's available in the brain. Paroxetine also has mild anticholinergic effects, which is why it's very calming and sedating for some people. And it also has mild norepinephrine reuptake blocking, which helps to increase norepinephrine, which also contributes to its antidepressant effects on boosting mood, motivation, and energy. So what is paroxetine used for? Well, paroxetine was FDA approved in 2001. And it was approved for the treatment of major depressive disorder, obsessive compulsive disorder, panic disorder, social anxiety disorder, post-traumatic stress disorder, generalized anxiety disorder, and premenstrual dysphoric disorder. So how long does paroxetine take to work? At therapeutic doses, you can start to see results within 2 to 4 weeks. However, some may take up to 8 weeks to see the full benefit of this medication. And when we're talking about therapeutic doses, we're talking about dosage ranges from 20 to 50 milligrams for depression. And if you're looking at the controlled release of paroxetine, then that's 25 to 62.5 milligrams. For anxiety, therapeutic dosing of paroxetine is 10 to 60 milligrams in the immediate release, and with the controlled release, 12.5 to 75 milligrams. So is paroxetine addicting? Well, no, it's not addicting, but just like as I mentioned in my videos on antidepressant withdrawal and antidepressants and addiction, these medications do not cause addiction, but they can cause neuroadaptation, and this is truly the case with paroxetine. And it is one of the most difficult antidepressants to come off of. And that is because not only the neuroadaptation, but is also theorized to be because of its anticholinergic effects and having an anticholinergic rebound effect. It's also theorized to be very difficult to come off of because it inhibits its own metabolism. When you decrease the rate of the medication, the rate of decline of that medication is faster as you're trying to stop it. So that's why they created the paroxetine controlled release. Now, what I found interesting about this controlled release is that it actually has a shorter half-life than paroxetine. So the withdrawal effects of paroxetine are not really related to its half-life, because it has a half-life of 21 to 24 hours, whereas the controlled release has a half-life of 15 to 20 hours. And so the controlled release is actually releasing it over like a 4 to 6 hour window. So it decreases the inhibiting action that this medication has on itself. And that's why that half-life is decreased. And that's why the controlled release ends up being more tolerated and is also suitable for some patients when they're coming off of it. However, I haven't had much luck with that and instead need to use a liquid form. And thankfully, paroxetine actually does come in a liquid form. And so because it's available in liquid form, it's best to taper that way. And many times you may need to add fluoxetine to the taper regimen as a crossover in order to tolerate the taper of this medication. And so what are those side effects of paroxetine or Paxil? Well, there are many side effects, and this has to do again with the self-inhibition of the medication. And a lot of times patients have a hard time tolerating the side effects, and they can actually last a little bit longer than the other antidepressants. So speaking of side effects, the most common ones are going to be nausea, sleepiness, weakness, headaches, dizziness, trouble sleeping, dry mouth, constipation, diarrhea, sweating, and shaking. Sexual dysfunction is also a major problem with paroxetine. And this has been contributed to the fact that it has inhibition on the enzyme nitric oxide synthase. And because of this action, it actually prevents the vasodilation of smooth muscle and those vessels themselves. And so a lot of times males will have trouble with this medication in producing an erection. So if you look at this table here, you'll see that in this clinical trial of 3,200 patients, which is a pretty big trial, they found that paroxetine actually has a large incidence of sexual dysfunction, and predominantly in males. And you'll see that up to 28% of males will experience the ejaculatory disturbance, and that's most likely related to the inhibition of the nitric oxide synthase. Now, females can also have some problems with this medication with decreased libido and orgasm disturbance, and that's up to 9% of females. So keep that in mind with this medication. Some less common side effects could be feeling anxious, loss of appetite, urinary frequency or urinary infections have been reported, and yawning. Now, some rare but potentially dangerous side effects are, of course, the black box warning that goes with all of the antidepressants, and that's suicidal ideation. And I talk about all of the rare and dangerous side effects in the video on the first-line treatments for major depressive disorder. So if you missed that video, check it out. I have it time-stamped, so it goes over these in detail a little bit more. But of course, the black box warning is the suicidal ideation that can occur in ages 24 and younger. Now, of course, if that happens, that's an emergency. So make sure you let your provider know right away if you're having suicidal thoughts, and make sure you get to the emergency room if it's persistent. The other thing that could happen are many blood dyscrasias with this medication. What that means is it can cause low levels of red blood cells, which can lead to anemias. It can also cause low white blood cells or leukopenia, and thrombocytopenia, which is low platelet counts. So just make sure when you're taking any type of psychotropic medications and antidepressants that you're getting your labs checked at least every 6 months. Now, because serotonin binds to platelets, it actually decreases platelet aggregation, which can increase your risk for bleeding. And this becomes more prominent if you're on blood thinners or if you're taking NSAIDs like ibuprofen consistently or aspirin. That can also increase your risk for bleeding. So if you start noticing increased bruising or any signs of bleeding, make sure to let your provider know. And so now we're going to talk about drug interactions with paroxetine or Paxil. So because paroxetine inhibits its own metabolism, there are some drug interactions to consider. Now, it's primarily metabolized by the CYP2D6, and it also inhibits the CYP2D6, hence inhibiting its own metabolism. So make sure to do your drug interaction checks to make sure that there aren't any interactions with your medications and paroxetine. Now, paroxetine is also highly protein bound, and so it can displace other protein-bound medications like warfarin or Coumadin. So if you're on this medication and taking Coumadin, make sure to get your INR checked very frequently while on this medication to see if it's affecting those levels. It may also increase the anticholinergic effects of other medications because it does have some anticholinergic properties, so you're going to have to be careful with anticholinergic medications as it can increase those side effects. So you want to avoid the use of beta blockers, codeine, and even atomoxetine, which is another type of antidepressant with this medication, because it can inhibit the plasma levels of those medications, which can lead to increased side effects. It can also increase the levels of thioridazine and pimozide, which are antiarrhythmic drugs. And so when it's increasing these levels, it can actually increase your chances of cardiac arrhythmias or prolonged QT intervals. Of course, with all antidepressants, you want to avoid the concomitant use of the MAOIs or monoamine oxidase inhibitors, as this can put you at an increased risk for serotonin syndrome. And make sure to be very careful if you're pairing this with other antidepressants that can also increase serotonin, because you could also put yourself at risk for serotonin syndrome by doing that. And as I mentioned before, those bleeding risks, you want to be cautious with the use of NSAIDs and blood thinners. And so my final thoughts. Is paroxetine the worst medication to be on? Well, what do you think? In my opinion, I don't like paroxetine. I'll be honest. I don't like prescribing it at all. The only time I'll prescribe paroxetine is when I'm helping someone to come off of it, Or if someone comes into my office and they say, you know, I've been on paroxetine before, it's the only medication that's ever worked for me and I really want to get back on it. So I let them know all the risks and let them decide whether they want to go back on paroxetine. And the reason I don't like paroxetine may be obvious, but it has a lot of side effects. It's very difficult to tolerate. It has one of the highest rates of sexual dysfunction, and it's one of the worst of the antidepressant medications to come off of. So if you have been on paroxetine before and you were lucky to get off of it, it doesn't necessarily mean that the next time you go on this medication, you'll have the same luck. So just consider yourself lucky and think twice about getting back on paroxetine. So that wraps up my review of paroxetine or Paxil. Have you been on this medication before or are currently taking it and would like to share your experience? Drop it down in the comment section below because we learn from sharing each other's stories. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you next week.